First day I was walking, after 20 minutes I started having chest pains, like somebody's poking a needle into my heart. While carrying on walking for 5-10 minutes more, my hand started to go numb. Then I realized, something is not right.
Angina, or chest pain that's caused by a narrowing in a coronary artery, we see it in millions of patients in the UK every year. And what we know worldwide is that over 500,000 stenting procedures are performed for angina every single year. We have two main treatment options. One is medications that can improve the symptoms of chest pain in these patients, or a stenting procedure where we balloon and open up the artery and then put a wire cage called a stent inside to open up the narrowing, improve the blood supply to the heart, and hopefully make them feel better. So the ORBITA 1 trial was designed to really answer the question of whether stenting improves chest pain in patients with stable coronary artery disease. It was the first trial to test stenting versus a placebo procedure, which meant that we had to be able to recruit patients who were willing to be part of a trial in which they had to have the whole of a procedure with all of those associated risks, but not to have the stent put in. We did this in patients who'd already been given chest pain medication as per the guidelines to improve their chest pain and were still symptomatic. And then we randomised those patients to either having an angioplasty procedure or a placebo procedure.
I was not aware, which group I'm gonna be. So it was a bit of mixed feeling, a bit of fear, a bit of excitement, a bit of curiosity as well. I knew that the research will help other people in the future getting the best treatment for their conditions.
The first ORBITA study really showed some surprising results. We found that stenting patients, when compared to a placebo procedure on a background of many anti-anginal medications for their chest pain, did not improve their symptoms because the anti-anginal medications had already worked to some extent, and that the additional effect of stenting these patients didn't improve their symptoms any further. As is always the case with clinical trials, we often end up with more questions at the end of the trial. And at the end of ORBITA 1, what we knew is that it was time to design another trial, and in stepped ORBITA 2. And that trial was designed to try and work out if stenting truly improved patients' symptoms versus a placebo procedure in patients who were not taking anti-anginal medications, to work out what the true effect of stenting was without the effect of those chest pain medications. We have many patients from the ORBITA 1 trial who helped us to inform the ORBITA 2 trial. The stenting procedure actually improves the blood supply to the heart, whereas with the chest pain medications, that narrowing is still there and the blood supply to the heart remains much the same. The greatest impact of our stents is when it's delivered as an upfront procedure before considering anti-anginal medications. I think our patients want the ability to make choices. When patients come to us with stable angina, we can give them the option of either the chest pain medications or the angioplasty procedure to hopefully alleviate their chest pain.
So since the trial, I was given 3 stents in my heart. Since then, I've started playing cricket again, which was literally impossible before the treatment. I feel really proud. Whatever sacrifice I have given or the other people have given for this research will improve other people's life in the future as well. So I'm really proud of it.